Welcome to the Seniors Flourish podcast, where it's all about helping occupational therapy practitioners working with older adults be the best they can be. And now your host, Mandy Chamberlain.
Hi everyone. Before we get started, I wanted to talk about Seniors Flourish's sponsor, Great Seminars and Books. What I really like is that their mission is focusing on geriatric rehabilitation education and training for clinicians, which, as you know, is near and dear to my heart. They have great live courses focusing on topics such as clinical orthopedics, cancer rehab, or even topics such as clinical neurology. There is a course for anyone looking for evidence-based practice and treatment ideas while working with the older adult population. These are definitely some topics that I am interested in, and I think you should check them out too. So head on over to seniorrehabproject.com/great and use my promo code SRP25 to get $25 off your next course. Welcome everyone to the Seniors Flourish podcast. I'm Mandy Chamberlain. I'm an occupational therapist, and I am excited you're here. So if you are new to this podcast, welcome. I run seniorsflourish.com and the Learning Lab membership site where there's tons of OT resources, treatment ideas, journal clubs. And so if you haven't checked that out, make sure you do. But today's topic is a good one. I am talking with Kimberly Kearney. She's an occupational therapy assistant, and we are going to be chatting about driving and community mobility from a generalist viewpoint. So welcome, Kimberly.
Thank you. I'm so excited to be on and talk about this important topic.
Well, it's a big one. So we're going to cram as much helpful information as we can in the podcast here. But let's just talk a little bit. Let's start like I always like to start, just kind of what is your OT journey and how did you get to your role that you have today?
Okay, so I've been a practitioner for about 15 years, and this is not my first career. A long time ago, way back in the 80s, I worked at a children's hospital as a volunteer in Philadelphia. And so this last national conference was important to me because it was a full circle moment, the circle of life thing. But anyway, as a volunteer, I reported to a child life specialist who was an OT, and it made me think, I wonder what that is.
Yeah.
Like many people, I didn't know what occupational therapy was. So, fast forward, kids, marriage first and kids, and then a career change opportunity, and I went back to school for OT assistant. I just didn't want to commit the time to go for my master's, just because, life would have gotten too far ahead of me. But anyway, so I became an assistant about 15 years ago, and just a few years ago, about 3, I was invited to participate in the Commission on Practice, which is part of the AOTA services that are provided. And it's a volunteer opportunity, and learned a ton from being on that. So it's really good to participate as a volunteer in our national organizations and, of course, our state organizations as well. So anyway, I walked into that really not knowing what I was going to be doing. And my first project was with driving and community mobility. And that has been an eye-opener and an opportunity for me to explore the topic a lot more. I started attending sessions so I could meet the authors that were going to update the paper I was working on. And the paper is the official document that's published by the AOTA. And so I just got more and more interested in the topic and started learning more about it. So self-taught opportunity. There's lots of opportunities to become more officially certified in the driving topic. We could talk about that later, but that's how I got involved.
That's where you are today. So what is your role in your current facility? Are you specifically for driving? Yeah.
No, not exactly specifically for driving. I work in acute care and rehab.
Okay.
I float either facility, depending on needs. And in the acute care setting, I address driving differently than I would in the rehab setting. But I have no specific certifications, although I'm looking at exploring that. You don't need them.
Yeah.
As an OT practitioner, we have the tools we need. We just need to add a few more tools into our toolbox, so to speak.
Absolutely. I think, we chatted about this a little bit before, but it's one of those things I think it's absolutely part of occupational therapy in what we do. But also it's like, I think people get intimidated a bit by it and they don't know how to bring it up and they don't really know what our role is within that. If you're not a specialist, and it's like, I can't take their keys away, or I know they're not safe, but there's a lot of gray areas if you're not comfortable with it. So one of the reasons why I'm super excited about this subject. So
yeah,
I know.
Yeah. So I don't know if you want to dive into that, or if you have other precursor questions you want to ask first.
No, I guess that would be a really good entrance. Like how do you bring up the subject of driving? If your patient is driving, or if they're driving, if they're not driving. Let's just start there.
So I will say, on full disclosure, I was originally nervous about the topic, so I totally understand.
Yeah.
How practitioners can be nervous. But what I did is I empowered myself with knowledge.
Mm-hmm.
So one of the things that I did was I listened to or watched. It's AOTA has a video that's on the ethical obligation for occupational therapists to address driving. And once I heard that and listened to that, saw that, it was sort of eye-opening, like, oh, wow, I really need to do this. And of course, we can include the link in your show notes about this.
Definitely will.
Video. Yeah. So it's only an hour long, and I thought, well, I could do this for an hour, easy. Then I attended a session where some driving specialists did some role playing, and that helped a lot, just to give me the words, and basically, started to address it with patients, just bringing it up as a simple part of the discussion. So how are you going to get where you want to go after you get dressed in the morning? And if the person is at risk for driving, because maybe it's just a temporary reason, it could be something ortho related, or generally ortho is temporary situation. A lot of times people have family and friends that can support their transportation needs, but they may not. So I started to put together some resources, local resources for people with disabilities or seniors to get around. And there's lots. Once you start to look and ask around, you can talk to your case managers on the floor. You start to put together some simple things. There's always Uber and taxis and, Lyft and other situations like that. But that's a more expensive option. So I started to look for less expensive options. Of course, public transportation is an option. Some communities have really good public transportation, others don't. And, of course, accessibility to get to the bus or train could be a problem. So then I started looking at paratransit opportunities in our area. And so that can be things for our area that's via. And our public transportation also has an arm or sub-branch or whatever you want to call it for people with disabilities, and teaching them how to use public transportation options. They also have the ability to do a door-to-door service for people with disabilities.
Okay.
So maybe local communities have that. And then also just talking about safety with ambulation in the community. So, so I started to put together those resources, and I started to hand that out, and then to patients, and then and their families, and then people started adding more and more things to include in that. There is some national organizations that provide some support in this regard too. You've got stuff like ridesinsight.org. I don't know if people know about that, but there's volunteer drivers through that website.
I was not aware
and
of that
that's
one.
Another option.
Yeah.
So it's good to look at churches and other kinds of organizations like senior centers and see what they can offer in terms of resources. A lot of churches have volunteer drivers that take people to services, but that's not the only option. Sometimes people in the church will drive to doctor's appointments and things like that. So then I started talking to patients about getting around with their equipment and talking about pros and cons of like a four-wheeled walker versus a front-wheeled walker, and how they're easier to get in and out of cars and trunks and things like that.
Yeah, that's a really good point, because even sometimes I know like some of the transit options, like where I live, which is a little bit more mountainous rural, but like they, will pick some people up, but they won't like open the doors, get them out of their, they have to be able to get out of their, their apartment or their house or whatever and get to there. So like that's, even that part of the whole community mobility is an area that we can be addressing in order to access the actual bus or some of those resources. So yeah, definitely.
The paratransit.
And paratransit and those kinds of things. So yeah, it's like, it's bigger than just actually getting the ride.
Right.
Sometimes.
So honestly, having the conversation, just opening the door might be the only thing you do in acute care. It's a real brief discussion generally, and you just open the door by saying, have you ever talked to your doctor about driving? Have you considered how you're going to get out of the house to transportation options, with your equipment? Have you ever talked to your family about driving? Right. What do you think about your driving skills now that you've had this blah, blah, blah surgery? So, and express my potential concerns about what the driver might have problems with. Now that you just had surgery on your right knee, your right leg is probably not strong enough right now, and you don't want to return to driving until it is. Because remember, every time you get behind the wheel, you're accepting responsibility for what you do when you're behind that wheel.
I like your verbiage that you use, that you kind of put it in their court, and you're not just going in there and telling them, you shouldn't be driving. You express your concerns after you have you open the door and, peek inside and say like, hey, or what are your thoughts, or how do you feel? And it also kind of gives gives us an insight on how they view themselves and their limitations and strengths, and like, they may be like, I'm totally fine, I'm going to be driving. And you're like, is there a cognitive component to this whole thing as well? Like there's
absolutely.
Yeah.
Absolutely.
So I like those like little phrases. I think even having like a little, pocket of phrases to kind of help, like you say, get the conversation going, is super helpful.
Exactly.
Especially if you're nervous about, bringing it up.
Yes. And it is a little scary because, one of the things about driving is it's the most important IADL to the patient. Yeah. So it's their opportunity for getting outside into the world. And we want to encourage that. It's not something we want them to stop doing. Right. We want them to do social activities. We want them to do volunteer activities or work activities or other things. So certainly worship opportunities, all of those, getting to the hairdresser, the grocery store, they're very important. So we want to maintain that independence, but just through a different avenue.
Mm-hmm.
Sometimes it's temporary and sometimes it's permanent.
Okay. That's
when
insight.
It goes to the permanent side.
Yes.
Then that is just a referral. That's not something I'm going to get into the details of, other than here's a phone number or here's multiple phone numbers. So again, I have another list of those to assess your driving skills after you leave the hospital, when the time is right, when you feel and your doctor feels like it's time for you to return to driving.
Okay.
So that's another little handout that I have.
Okay. And is that typically probably, I'm going to just assume that's typically given in the rehab setting?
Right.
Yeah.
But sometimes acute patients don't go to rehab.
Right.
Let's say it's a multi-trauma kind of situation. There's no cognitive impairment. They just need time to heal.
Right.
And, there could be a mild TBI involved, or even just a concussion. And so the client is likely to heal completely from that. Just it's going to need some time.
Okay.
And they or their insurance company may want them to have a driving assessment.
Mm-hmm.
Or their doctor may. So then I'll just give them resources for that, for when the time comes.
How is kind of like, how is the communication between like the physician and the OTs, like example, like in your facility, like do the physicians, like I will say from my experience, most of the time, like no one is addressing it. I feel like, haven't the doctors addressed this? Like obviously they shouldn't be driving. And I'm kind of feel like sometimes I'm in a little limbo. Like I may bring it up. The doctor doesn't know exactly what to do. Like where I live, there's not a easy referral source, like for a certified driving rehab specialist. And so I feel like sometimes like nothing ever happens. And like, I feel like that's not good either. Like that's part of our role.
Right.
And I think, having the discussions and helping with alternative, methods is a really good start, and probably something that I should be, integrating more into my standardized evaluation. But is there any kind of, assessments or any kind of, is it mostly just an educational standpoint? Like if you're, since you are also not a certified driving rehab specialist, but obviously you do a lot, you address it a lot. Like what could kind of be an avenue that a generalist, where could we start? Do you know what I mean? Opening the door of conversation, giving them some resources. Like what would kind of be a next step, or is there a next step? So really good questions. So the first opportunity for the conversation I find is a great seed planter. Okay.
Just opening the door like you're talking about. Mm-hmm. The patient has an opportunity to kind of just think about it. Ooh, I hadn't really thought about this.
Yeah.
And then they need some kind of time to process that. So then when we get to the rehab setting, I feel like we're already doing a lot of the assessments that are components of driving. Mm-hmm. And you can just translate that to driving skills. So that as a generalist is really what we definitely can do. All of us can do this.
Yeah.
You're looking at vision, you're looking at cognition, you're looking at mobility.
Right.
Now report that within the context of driving. Mm-hmm. I'm concerned about your driving because of your change in visual, skills. I'm concerned about your driving because of your change in mobility or your change in cognition. Mm-hmm. And then, discussing it with the patient is a huge ethical obligation, I feel like. And part of that obligation is not just to the patient, but to the community at large. You have an obligation to address what you see. And if you see something, you have to say something. We've heard that before. Yeah. So I include that in my documentation. Okay. My daily notes in the acute care setting or in the rehab setting, either setting. But in acute care, I will say that we've discussed the topic of driving. and addressed any transportation resources. And then maybe a referral down the line for driving eval. Maybe that might be part of my documentation. Or the patient declined transportation resources, but driving was addressed.
I see.
They will have their family and friends support their needs. Okay. So at least it's documented, and I think that's important to document, because I think, okay, when the patient leaves us and we don't address driving, they don't have a clue that, like you said, that there is a potential problem there.
Right.
So at least I'm documenting that it has been a discussion. And then as far as the physician is concerned, they see those notes and they see that this is something that needs to be addressed down the line. So in the rehab setting, again, we provide resources, and that might lean more towards the driving eval. And you don't have to be a certified driving rehab specialist or a driving rehab specialist, because there, of course, is a difference between the two, to address driving in the outpatient setting or any other home health or any other stage in the recovery process. But what we do, we just translate it into the skill of driving.
Okay.
And then when it comes to behind the wheel, or any rehab potential behind the wheel, or any kind of physical changes to the vehicle, now that will involve a certified driving rehab specialist.
Exactly. Okay. That's good to kind of differentiate.
So to me, that's the line.
Yeah.
Behind the wheel or not behind the wheel.
Right. But like you said, we can address all those things, like the reaction time, the visual changes, decision-making, judgment, all those things. We're going to probably be addressing those and for other areas anyway. So you're still touching on those, just looking at it from a different point. How about, do most of the occupational therapists that you work with, is that part of their goal setting? Is that part of a goal, or is that just something that is addressed during treatment sessions? It probably depends on the facility and so many things.
Yeah. So I'm thinking in acute and rehab, it's not really appropriate to have driving as a goal, but maybe components that lead to driving are a goal. So improved mobility in order to, down the road, address driving skills. So I look at it well, this is kind of square one, and we're not going to be to actual driving until square 3 or 4.
Right.
But that's fair for the client to have that goal. Now, in outpatient or home health, they could be real goals.
Right.
So, kind of thinking of that as square 3 or 4, now, as a specialist or as a generalist, you can start to address the driving goals. And of course, you do much more in detail assessment at that point. So as far as assessment tools are concerned, there's a really great resource that's called the Clinicians Guide to Driving.
Ooh.
I don't know if you're familiar with that.
No, but it sounds amazing.
Oh, it is really this is first thing to get.
Okay.
It's free, which is
double
wonderful.
bonus. Okay.
Yeah. Super comprehensive.
Is that through AOTA or is that a separate?
So it's Geriatric Society. It used to be the and it's online, free. You can just print it offline, and I'll put I'll give you the link for that
perfect
for the
show notes. I think that's something that a lot of people would really like, those resources. I mean, I don't know. Yeah. I'm kind of a resource nerd. I love researching. I love reading research. I love digging around and finding what I need. So, those are little nuggets of OT fun. No,
Yes,
that'll be perfect.
exactly.
Okay, we'll put that in the show notes. Okay, so what can you give a brief description of what that kind of looks like, that resource?
Yeah, so it's really comprehensive, for
okay.
assessments. And it addresses a whole bunch of cognitive options, visual options. It's probably 300 pages, just to warn people.
Oh my gosh.
To make sure they have the ink and the paper to handle it. But it is so great, and it's really comprehensive. And it gives you some good verbal things, some good words to use when addressing driving with both the client and the physician, because, physicians don't have a lot of schooling about driving skills.
Yeah.
Unless they've picked it up in their practice as an important thing to address. It's not really addressed very much in school for them. So they really want our support in this, because this is so OT, and it is so perfect for us to address.
I agree. Yeah, I love those, like I said, I love those resources, but something that I've been using, there is a driving decisions workbook through the University of Michigan. It's basically just like a workbook that the family and the patient can kind of go through together, and it kind of just looks at areas that they see. Because sometimes, like you said, sometimes you bring up the topic, and some people are defensive. Now, I can drive, I can be fine. And then the family members are like, ooh, maybe not. And so like, it's kind of like it kind of goes through like different scenarios, and it goes through different things of like, then they can work through it together and process that and kind of have discussion. And I think that that's helpful for me, because like I said, like, most of the time when I'm have those patients that I'm concerned about, like that's not the primary reason I'm seeing them. So like, it's kind of like, okay, yeah, the family's concerned about driving. The patient's not concerned about driving. I'm not necessarily addressing it per se, like specifically, because one, I'm not a driving specialist, and two, I'm not exactly sure where my role, how to really define my role in that. And so I've been kind of giving them this workbook, and they've been kind of going through it, and it's been actually very helpful. I think it's helpful, like you said, the whole being able to process the information, and as a family being able to discuss it. It's not appropriate because, as in for every patient, of course, as in some families, that's not an option, but like, it just kind of brings up an idea and a topic that sometimes it's a little, sweep under the rug because no one wants to address it. Because they're just, I don't want to get in a fight, or I don't want to be the one to take the keys away, even though there's lots more options. But it's a tension. Right.
So there's some other really great resources as well for this. Kind of along the lines of driving decisions, is the Hartford has some really great resources, and these are free as well. We Need to Talk is the name of the topic. And so when you go to the Hartford Insurance Company's website, you just do the We Need to Talk in the search section, and you get it. And you can order these things for free. There's some great brochures in that, and it comes in a really nice packet, and there's some questionnaires in there for the driver and their family members. And that's an amazing resource. It gives you the words in there as to address as an OT. So it sounds a lot like your driving decisions resource as well.
Yeah, I think it's just getting the conversation going. And like you said, sometimes the physician's not addressing it. We need to make sure we're providing that education and resources, at least. Because sometimes, like you said, I think that it's because it's such an important IADL, and it's one of those things that if someone said you can't have your, keys anymore, people just feel like, they've taken away so many things. It's not just driving, like you said, it's the social aspect, or, being the independence. And there's so much that goes into it. It's so personal. And so we have to make sure that we are, having those discussions and making sure people are safe. So let's say you have a patient that you feel is just not safe. and they are still driving. I can think of a scenario when I was doing outpatient. We would have a patient coming in, and you could see from our clinic, like we had these big windows to the parking lot. And I remember him driving up and hitting like one of these posts, and and he had Parkinson's. And I remember he wasn't my patient, but it was one of those, like, I work in a small clinic. We all know each other. He'd been my patient before, and it wasn't, and I fully admit, it was not something I brought up before. And I remember, saying like, "Hey, how is driving going?" And like, he was totally oblivious, and his wife was just like, "He won't listen to me." And you get in these kind of pickles, and you're like, where is like also my ethical obligation? Like, do I have to report? Or, like, do you know about the like general laws? Should I be reporting to the physician? Should I be reporting to the state? Like, I feel like they're not safe, but like the family's not going to do anything about it. He's not going to quit driving. Do you know what I mean? Like, sometimes it gets in these little funky situations.
So in Colorado, which is our state, it's a self-report state. So when you go to renew your driver's license, you are asked questions about, have you had a recent stroke or TBI or some diagnoses that might affect your driving skills. But it's self-report. So if you're impaired cognitively, you might not consider yourself at risk.
Absolutely.
So, Or it might be, I think the time frame is 2 years. Did you have any of these events in the last 2 years? I think the time frame is 2 years, so it could be 2 years in a day, and they can say, no, I haven't had any of these events. But that doesn't change their safety behind the wheel.
Absolutely.
So anyway, it's important to look, you're mentioning something that's very important. It's important to know your laws, your state laws. In Colorado, we have this really beautiful brochure that's free. I like the free resources.
There's a lot of free resources.
Yeah, there's a lot. There's a lot. What I was going to say is out of my head.
Oh, that's okay. Maybe just encouraging people to go figure out their state laws.
Yeah. So the AOTA.org website also has kind of some brief things about your state laws, and it's got all 50 states in there.
Okay.
So AOTA has wonderful resources.
Yeah.
It's really full and rich. And it can get you caught up and take a lot of time to be in there. So go in looking for something specific. Because there's just so much.
And I know a lot of, specifically with driving, I know AOTA has a lot of those resources available, even if you're not a member. So making sure that you're digging around. Of course, I'm a pro AOTA member kind of gal, but like if you're not, you still can use and access a lot of driving resources specifically on their website.
Sure.
So
and then another thing I would say is getting car fit in your local community. Participate in an event, do an event, get yourself trained. It's really easy. It counts as CEUs. It's 2 hours online and then 1 hour in like a lab portion where you actually are hands-on with an instructor. And so that's 3 CEUs that, again, are free. I love free resources. So, and then in addition to that, your time at the event also counts as CEUs.
Can you explain CarFit, Kimberly? Like, if people aren't familiar. That's okay.
It's a wonderful program, and it's very it's pretty comprehensive about the fit of your car to you and the reasons why you want that to be a safe experience, like your seatbelt, obviously. Sometimes people find their seatbelt to be uncomfortable, so they don't use it as well as they should, and so there's ways we can show them how to make it more comfortable. That's just one. It's a 13-point review of your car's fit to you or your fit to your car.
Okay.
And there's safety things involved in that. And it's just, as an OT practitioner, it's a great way to just open the door for you to learn about driving. And so that's a wonderful opportunity. And then it's a collaboration, like many of the driving things. A lot of these resources that I'm talking about are collaborations between AOTA, like the Hartford, the National Highway Traffic Safety Board, NHTSA, the AAA, AARP.
Yeah.
They all find this topic important, and we've collaborated with them. Our national organization has done a wonderful job of providing great resources for us. So CARFIT is just one. And the We Need to Talk program, you can also do that as a facilitator at a senior center or some sort of organization like that.
Yeah.
So it's great to, there's a webinar on the AOTA website for that.
I was not aware of that one either.
And that free packet can be sent to you with the DVD that makes it super easy to be the facilitator. All the work's been done for us, for CARFIT and for We Need to Talk.
It's just
and we Need to Talk is, right, exactly. It's just applying it. And it's really just a few hours. You just kind of get the book, you do the 1 hour webinar, and you can put together the information to facilitate the program.
Yeah.
For We Need to Talk. And so that one's more a classroom setting, and that we invite family members and the driver. It can be just the driver or just the family member, but it's much more beneficial for the team, the family, the team to go to the event. Yeah. So, and that one combined with CARFIT, doing some general resources for transportation for outpatient setting evaluations, whether it's a certified driving rehab specialist or not. And then it's a great way and the Clinician's Guide, just an amazing, amazing resource.
Yeah, I think those are the things that, we just need to fill our toolboxes a little bit. We need to fill them with all sorts of information. And like this driving stuff is really good because like you said, it's like making sure we're having the conversation and making sure that they're, they are aware of different types of community mobility in addition to driving. And then it's like, okay, making sure we're assessing those things, making sure that we are integrating some of those components into our treatment activities. And then also just like you said, like CARFIT, getting that awareness out, getting the families, getting more people more comfortable with the topics. I think, of course, we always would love for families and patients to, be more, look at it from more of a preventative standpoint and say like, okay, if this happens, but that's a very small percentage that have ever had this subject or this topic discussed as a family or even as a couple.
Yeah.
And so like just having the resources,
Yeah. So another great free tool now that you mention it for families to be proactive and preventive. It's available on the AOTA website, and it's called a transportation plan. And just like we plan for retirement financially and as well as where we're going to live, how are we going to get around? And it's a one-page document where families can work together or the client can just state who they would like to be the person who addresses driving with them in their family. It could be their spouse, it could be a child or one of their adult children. Could be some other family member or friend that will address the topic of driving with them when the time comes. So it's a proactive approach.
Yeah, definitely. Yeah. That's a great one. Good one.
And the language in this document is really nice. It's great language.
Yeah.
So.
Okay.
So that's another way. Driving is not a one-time conversation, unfortunately.
It's
it's something. Big. Yeah, it really is a big topic. And so it's important to people. And so it's really our obligation to at least plant the seed, start the conversation going, and support the family who's overwhelmed. A lot of times a family's overwhelmed, and we just take that just like any other topic, one step at a time.
Yeah. Well, and you think I just kind of something random that came to my mind is, we're talking about driving, community mobility, but as we know, this is like so much bigger, like things, and then trying to figure out how they can access those things, as in the things people worry about, like how do they get to church? How do they get to playing bridge on Tuesdays at the senior center? Okay. Those types of things. But then all the other things that you do with driving or community mobility, who is going to how am I going to get my groceries? These are some concerns I've heard, like, how do I get my groceries? Who's going to who's going to pick up my medication? And so like that, we can easily incorporate those things into our treatment plans and address that. Mm-hmm. I mean, that is obviously so OT based. I mean, there's so many options. Groceries, they deliver groceries now. I mean, like there are different options out there, but sometimes people just don't know them. And like part of it is like making sure that we know the resources available in our own communities.
Exactly.
Especially when I did home health. I mean, probably all my settings I've worked in, but home health, you really need to know where can you get, DME, or where can you get this and where can you get that? And like giving those resources out. Like, I think what's hardest is when you move to a new community and you're starting all over and like trying to figure out where everything is, who are my people that can help. But also, like you were saying, like there's families start telling you, oh, well, what about this? And you're like, didn't know that, adding that to the list. And
that's how it starts.
Mm-hmm.
You just put together the list, get it started, and then it's fluid. Mm-hmm. You keep adding and learning more. And in the meantime, you've at least provided some resources and started the conversation.
Mm-hmm. Absolutely.
So, and just like you said, it's so OT. And it's an easy way to address driving. And I hope that's what your listeners see, is that there's a lot of very easy ways to start the ball rolling.
Mm-hmm. Yeah, and it doesn't have to be as intimidating as it feels.
Right.
I think. So anything, kind of just wrapping up, is there anything that else? I mean, you have this amazing list of resources that we're going to give to people if they want to check those out. I also have a list of, assessments, family assessments, client assessments for driving, community mobility I'm putting together that will be in the show notes on the website too. Is there anything in closing that we kind of maybe didn't hit on, or did we miss anything?
Not that I can think of.
I don't think so either. I think it's really great to like you said, introduce some of those things and like make sure that we're talking about it and like getting our little OT brains thinking about what can we do to making sure that we are being as holistic as possible. We can't know everything. I want to know everything, but we can't know everything. But but it's like, just, okay, like making sure that that is part of our evaluation, or making sure that even the topic is just brought up. But I really, really appreciate you. I really appreciate you putting together all the resources and chatting with me today. It's been a great topic.
Thank you. It's been a pleasure.
All right. Thanks everyone for listening. Until next time.
Thank you. I'm so excited to be on.
Hi guys, don't forget to check out the live courses from my sponsor, Great Seminars and Books. I love the variety of courses they offer, specifically because they are relevant to the populations that we are working with every day, older adults. And their topics include things such as home health, a specialty course of its own, and clinical implications of pharmacology for the therapist working with the older adult. So all these topics are relevant, evidence-based, and very practical. These are treatments that you can learn in the course and take back and use right away. So head on over to seniorrehabproject.com/great and use my promo code SRP25 so you can get $25 off your next live course.
This podcast is brought to you in partnership with the Senior Rehab Project at seniorrehabproject.com.